Cool. Well, hello everyone once again. My name is Taylor Watterson. I am a 2017 graduate from the University of Pittsburgh, now in the very, very final dredges of finishing up my PhD in health services research in pharmacy with a PhD minor in industrial and systems engineering, as Ravi mentioned. But I originally hail from Pittsburgh, well, a little bit east of the city, I guess. But as Ravi mentioned, I was in the original, well, one of the original iterations of the CLIP ARCO. You can see me here. This was while I was interning at Rite Aid, whenever they used to have their Wellness 65 Plus Wednesdays. And I thought I was going to be Miss Community Pharmacy forever. And then on the left-hand side was me presenting one of my first posters from my CLIP project at APHA in 2015, and I just got back from APHA in 2022, so can definitely take you there. But one of the big things that I realized when I was in pharmacy school and when I was working for Rite Aid, I had the opportunity to float around as an intern for the district, and so I got to see about 12 to 15 different Rite Aid pharmacies, working for a lot of different pharmacists. And one of the kind of the consistencies as I was floating around is I would always ask the pharmacist, hey, do you have any advice for me? Do you have any suggestions as I go forward? And not even joking, I can't tell you the number of times the pharmacist would look at me kind of deadpan and say like, yeah, don't become a pharmacist. And that was like the normal, right? Like you had all these pharmacists saying, don't become a pharmacist. It was just when the time, so you figure I started pharmacy school in 2013. Immunizations were just kind of becoming a thing. My CLIP project was all about medication synchronization. We were still doing a lot of MTMs, but we didn't quite know how to implement it. And so a lot of things where I would go to all of these different pharmacies and I would see different things and was trying to figure out ways to kind of integrate them into practice and try to understand some of those differences. So a lot of my research, now that I'm in graduate school, has to deal with pharmacist fatigue, but also the integration of health information technology and how we can promote both of those things to enhance patient safety. So my bigger research umbrella is under this idea of patient safety. But specifically today, we're going to be talking about something I'm very, very passionate about related to pharmacist fatigue. I do have a minor disclosure that the research that I'm going to be talking about today was funded by the Agency for Healthcare Research and Quality, or AHRQ, AHRQ, and so just keep that in mind as we go along. But kind of the overview for my talk today is I really want to highlight kind of three key areas. I want to talk a little bit about fatigue and what that looks like in pharmacists. I want to talk about kind of why we're all here, the use of wearable sensors and certain biomathematical models to be able to track fatigue, and then kind of talking a little bit about the future for pharmacy. What does that mean for fatigue risk management, and ultimately kind of get your insights on where you think we can go and how we can utilize this technology going forward. All right, so if you take one thing away from my talk, so I want to kind of dive into what it means to be fatigued. So very, very generally, fatigue is your body's biological signal for recuperative rest. It is your body saying to you, hey, we need to slow down, we need to kind of take a break, and you need some recovery or rest. And it can take a lot of different forms. It can be physical fatigue. So, you've just exercised over at the Pete and now you need to take a break. It can be mental, like, oh, I just took this infectious disease exam and now I can't think straight. It could be acute, where, okay, I did this exercise and now I need to sit down for about a 15-minute break. Or it can be chronic of, I've stayed up for the last 15 nights studying for my infectious disease exam and now I need like a week-long vacation. It can be active. And so that is the fatigue that we think of whenever we're driving on a busy traffic highway, right? And we have to kind of navigate a whole bunch of traffic, or it can be passive. So whenever we are, I don't know if I can admit this person, there we go, or it can be passive. So whenever you're driving on kind of the Pennsylvania Turnpike and it is kind of never ending, the same, no curves, and you kind of notice yourself drifting off to sleep while you're driving. It can be defined as a very general lack of energy, but it can also be sometimes defined as sleepiness. One of the key things that I want to kind of bring your attention to is that fatigue and sleepiness often kind of get conflated together. People often think they mean the same thing. Oh, you're fatigued, you're tired, but that's not always the case. Fatigue is your biological signal to rest, whereas sleepiness and being tired is actually your biological signal to sleep. Now, I draw your attention for a very specific reason, and this is probably my soapbox if you get nothing else today, right? You can be sleepy and you can need to sleep, but there's no way that you can just rest and sit down for 15 minutes and kind of overcome your sleepiness. Sleepiness is a very specific type, or very more specific type than fatigue, whereas you can only overcome your sleepiness by sleeping. Right? You can't be sleepy and then sit down for 15 minutes or exercise or do some other type of recuperative activity and overcome your sleepiness. You need to sleep. Whereas fatigue, the rest that you use to overcome your fatigue, it could be sleep, but it could also be going for a walk. It could be meditation. It could be any other thing that you find that you need to do for recuperative rest. So the biggest outcome that you can take away from this is that fatigue and sleepiness are similar, but they're not necessarily the same term, and that's kind of a key thing that you'll see probably throughout. The other big thing that I want to kind of bring your attention to before we dive into wearable sensors is what causes fatigue. So a lot of the work that I do in health systems engineering, it looks a lot at our work demands versus our capacity to do work. Now, our work demands can be things like the number of tests that we have to study for, or the number of credits that we're taking, or our internships that are on the side, or all of these other things that we're required to do. And we balance that with our capacity to do work. So is it how much sleep we got? Is it, do we have kids or small children or dogs at home? Is it, do we have a good meal today? Is it we're under the weather, or we have COVID, or we have the flu and we're not feeling like we're able to perform our best? And so it's always this constant demand between, or balance between our work demands and our capacity and our resources to be able to do work. And so fatigue exists when there's this imbalance, where we find that our work demands are greater than our resources and our capacity to do work. And so a lot of times it's this balance, and we often find that whenever we're defining fatigue, or whenever we see fatigue in pharmacists, it's not that, they have 500 scripts to fill. It's they have 500 scripts to fill, and there are 3 technicians called off. They have, they're feeling sick. They're up all night with their dog who, they have a new puppy and has to go out every time at night. And then so it's finding this balance. In community pharmacy, I've often related to the easy 500 scripts and the really hard 50 scripts. And it's kind of that counterbalance between the two. Also, if you didn't know, or you couldn't tell from my research, fatigue is bad. We don't know too much about fatigue in pharmacists just yet, but fatigue in other health professionals has told us that fatigue can lead to increased errors for patients, can lead to decreased patient outcomes, even patient death. Fatigue can lead to incidents of needle stick injuries for nurses or physicians who are, providing vaccines, but it can also lead to car accidents on the ride home. I had a colleague tell me the story once about their friend who was in pharmacy school with them, worked in a hospital as a hospital pharmacist, and actually worked 2 kind of 12-hour shifts, so a total of 24 hours at once. Got in her car to drive home and actually fell asleep behind the wheel and passed away. Got into a car accident and passed away. So fatigue has a lot of implications, not only on our patients, but on ourselves as pharmacists, and taking care of us as the patient first. So here's my first kind of question for you, and I'm interested to hear your experiences, whether you're community pharmacy, outpatient pharmacy, what have you. Why might pharmacists be fatigued? Any thoughts?
Lack of staff.
Lack of staff, yep, great. Any other thoughts?
Dealing with angry customers.
Yeah, dealing with angry customers, absolutely. Getting yelled at all the time, great, yeah. Yeah.
In a hospital, there can be varying shifts that the same pharmacist will take on each week.
Sure.
So a lack of a consistent sleep schedule.
Yeah, okay, so varying shifts, excuse me if I'm paraphrasing, so like an overnight shift versus a morning shift and lack of sleep, great. Is there one over here, yeah?
Yeah, it's an unusually busy work day.
Okay, sure. What can make things busy or not busy?
Like a lot of scripts being sent in.
Sure, yeah, tons of scripts, high volume. Yeah, Mr. Wonderful.
Long hours, but with also very little breaks.
Yeah.
I know pharmacists who just work straight, like 12 hours, no break.
Yeah, absolutely. Long hours, no breaks to get bathroom breaks either. So yeah, those are all great options. Anything else anyone wants to voice? Personal opinions?
I think out of a workspace, I know a lot of times at Rite Aid, they go.
Oh my gosh.
So she just didn't go for 12 hours.
Oh my gosh. So for folks on Zoom who may not have heard, there was no access to like a bathroom. And so for a full 12 hours, a pharmacist wasn't able to leave the pharmacy to go. I can't even imagine the health impacts of that.
Yeah.
Like, wow, absolutely. Yeah, so some of the other things that I thought of, you're standing, a lot of community pharmacists at least are standing for 12 hours, so you have muscular strain, eye strain from staring at a computer, just the mental strain from high volume, from maybe not getting adequate sleep or rest because your shifts are super long, or et cetera, et cetera. So yes, community pharmacists have tons of reasons to be fatigued, absolutely. But here's my next question, and that's a little rhetorical, right? Is how do we know pharmacists are fatigued? So we have all of these theories of, we would imagine that pharmacists would be fatigued because of the work that they're in. But how do we know? How can we demonstrate to, organizations that this is a problem, or to our patients? How can we measure or quantify fatigue? So the main reason, I'm guessing, why most of you are here today, aside from your course requirement to be here, is this topic of wearable sensors, and how can we use wearable technology and wearable devices to capture fatigue. Before diving into that, though, I do want to do my due diligence just to talk about that there are a couple of different ways to measure fatigue. The first of which are subjective measures. So you could give someone a survey and say, hey, are you fatigued or not? And there are a lot of validated measures out there that can do that, that has been tested in other professions. You could do performance measures. So asking people, looking at their outcomes of how many scripts did they check, and the more fatigued they are, the more you peter off. There's a validated a measure out there. It's called a vigilance test, a psychoactive vigilance test. And it essentially pops a red dot on the screen, and it measures how fast it takes you, how long it takes you to click the dot as it moves around the screen. And the more fatigued you are, the longer it takes you to identify and click on the correct spot. You have behavioral measures. So are your eyes drooping? Are you unable to keep your posture? Are you losing your balance? Right? There's physiologic measures. So there's been some studies that have looked at salivary cortisol levels to be able to use that as an indication of fatigue, because fatigue and stress are highly correlated. And then one of the main reasons that I'm interested in is biomathematical measures, or wearable devices and sensors. So just as kind of a disclaimer, the bands that I use, or the company that I utilize, is a company called Fatigue Science. And you can see the wearable devices there. I actually brought some if y'all want to look at them. You can see they look pretty inconspicuous. Here, I'll hand a couple over this way. A couple over this way, so that you can see what they look like. Right, and so I have experience using one company, one form of this technology, but there are several others out there. And just kind of keeping that in mind, and a lot of my experience that I talk to, it's with this one company. So just to give you a little bit of background on fatigue science, it was developed by the U.S. Army, actually used as a strategy to assess fatigue in war fighters and in combat fighters. And then it was kind of the bands and the models were acquired by a company called Fatigue Science, and so that is where we get the name. I may use Fatigue Science, I may use kind of the Ready band interchangeably. And so they use a kind of, their company is called Fatigue Science, and the name of their devices, they call them, are Ready bands. And so if I say Ready band, if I say Fatigue Science, it's kind of one and the same. But here is how here's how the Ready bands or Fatigue Science predict fatigue. Follows a very similar kind of engineering, but also kind of like a machine learning model where you have an input, you have a process, and you have an output. So for the input, the Ready bands uses sleep and circadian factors to be able to capture sleep. And it does this using the band that you saw, which is also known as an actigraphy band. So the way that it works is on each of those bands, kind of the little screen on there, it contains an accelerometer, which is capturing your wrist movement, 16 measurements per second across all the different axes. So it's looking at, how your wrist is moving over time. And their assumptions are that the more you're moving, the more awake you are, or the less fatigued you are. It's kind of a hierarchy that if I'm up here, I'm giving a presentation, I'm moving my wrist around, I am more awake than if I were sitting on your side, listening, right? Not really moving around, is more awake than someone who's laying down and maybe awake, is more awake than someone who is laying down and asleep, and vice versa. Very similar to how your Fitbit may capture, your sleep data, and some of the metrics that are in that as well. So that's the inputs, right? The band captures all of that data, captures your wrist movements, and then it feeds it through a biomathematical model. Now, the model that this particular company uses is called SAFT, Sleep, Actigraphy, Fatigue, Task Effectiveness, or SAFT. I'm going to show you the model, but I don't want to freak anyone out. It can be sometimes a little overwhelming, but we'll walk through it very, very quickly as far as biomathematical models go. All right, so this is from the literature what their model looks like. You have your circadian oscillators, which is your circadian rhythm that tells you that you should be awake when it's daylight out and asleep when it's nighttime. That feeds into your sleep intensity and your sleep quality, so how good of sleep you get. And then that feeds into your sleep accumulation and how much sleep you get. And then that goes and fills up your sleep reservoir. I like to consider it like a gas tank, right? You're filling up your sleep tank and your gas tank. Now, interestingly enough, the sleep reservoir, right, when that is full, that is kind of what makes you feel not sleepy. But when it's empty, that's what makes you feel sleepy. Or that's kind of when you notice that you are sleepy, is whenever your sleep reservoir decreases, right? It's this kind of personal stimulation or drive to sleep. And then that feeds into your performance, right? So if you are exercising, if you are attending class, if you are taking an exam that depletes that reservoir, that's you driving down the highway. And then that kind of all feeds into, depending on the time of day, leads you, and your sleep reservoir, leads you to your effectiveness. And so kind of effectiveness is this culmination of, all right, how full is my tank? Am I checking prescriptions at 9 p.m. on a Friday after being awake all day? Or, am I checking scripts at 9 a.m. after getting 8 hours of sleep? And so it kind of takes all of these factors into consideration based on your wrist movement and based on the time of day to give you an output, which in this case is effectiveness. So the way that fatigue science predicts fatigue is through what they call a READY score. But essentially, it is this effectiveness component, right? Takes all of your sleep data, all of your time awake, what time of day it is, into this effectiveness. And they rank effectiveness on a 0 to 100 scale, right? So saying that if you're at a 0, you are not effective and you are very fatigued. If you are at 100, you are super effective and not fatigued, and any kind of ranking in between. It also kind of along with their ranking, and so again, they call it effectiveness score, they call it a READY score, because they have to put their spin on it, a READY score. But they also include calculations to make it equivalent to reaction time, risk for error, and an equivalent blood alcohol concentration, which is sometimes scary. So I'm going to show you data. This is from me as a fifth-year graduate student. But you can see along here, right, there's this, I don't know that I'll be able to see. Okay. So, right, so you have this green squiggly line down to a yellow line, right? And it aggregates my effectiveness data over time. So you can see kind of over here, they give you that 0 to 100 scale. So this is kind of 100 to 90, 90 down to 80. And then as the days go on, right? Okay. As the days go on, you can see kind of my aggregate. So this was October 26th, 27th, 28th, et cetera, gives you my aggregates over time. It also breaks it down, so you can see you have my average READY score. Again, it's that effectiveness percentage. Gives you my sleep quantity for the day, how many naps I took. It'll tell you what my sleep quality was like, and that incorporates fragmentation. How many times did I wake up per hour? We bounce over here. We have our sleep latency, which is kind of how long it takes you to get up. Once I'm waking up for the morning, how long it takes me to get up, my sleep efficiency, what time on average I went to bed, what time on average I woke up, and then how much variance there is in between there. So we have this for every pharmacist or for every participant or everyone that participates for every day that they wear the band. It also goes a step further, right? So that's aggregated by the day, and so it gives me kind of these summaries as I talked about these zones, right? So in this 90 to 100% range, we're at this high effectiveness where I would not be fatigued. You can see that I spend 70% of my time here. My reaction time would be slowed by 5%. working at a blood alcohol concentration of someone with 0 and a very low risk for accident or serious error. And this is all data that the company kind of aggregates for me. You can also see on the flip side, this is my reduced ready score zone or effectiveness between my range of 70 to 80. You can see I spent 0.6% of my time here with a 34% risk of reaction time slowing, working the same as someone with a blood alcohol concentration of 0.05 and an elevated risk for accident or serious error. So you can see it gives us a ton of data, and that's not even half of it. It also tells me all of my data down to the minute of where these ready scores are. These gray areas is when I was asleep, and then kind of carrying on. So you can see for me, I have these dips kind of in the middle of the day, where, you know, I might need a nap sometimes, right? But you can see kind of how it varies over time. And the type of data I can get is both aggregated to the day, to the person, but also down, I can give you minute by minute comparisons of what my fatigue looks like. So it goes back to our question of, are community pharmacists, well, for me, our pharmacist fatigue, and my specific interest of our community pharmacist fatigue. So to answer this question and begin to answer this question, I received money from AHRQ to give a bunch of these bands to community pharmacists and just see what happens. I don't know. Right? So I recruited from a group of practicing community pharmacists in Wisconsin, and I asked them to wear the Ready band continuously for 14 days. We chose 14 days because a lot of pharmacists work on 2-week shifts or 2-week payrolls. If you're familiar with like the Rite Aid model is, you know, a pharmacist works 2 days on, 2 days off, 3 days on, you know, et cetera, usually for a 14-day shift. But also it takes the Ready band 2 days to kind of acclimate to the wear and to calibrate to whether or not you're awake or asleep. So 14 days has been shown in the literature. And then in addition to wearing the bands, I also asked the pharmacist to complete some demographic and subjective fatigue surveys. Like I mentioned, I have other ways that you can capture them. And then for the analysis, we did kind of this preliminary SAFT, where we utilized the SAFT model to say, like, what is going on in our pharmacists? So as I mentioned before, it's kind of this balance between capacity to do work and our demands. So you can see for our pharmacists, about half, 44% of them worked for a national chain and kind of some varying degrees elsewhere. That other are individuals that worked in outpatient community pharmacies for a big health system in our area. You can see about 66% of the individuals were female, which kind of aligns with where the demographics or where the split is going in the profession of pharmacy. And interestingly enough, 75% said that they had some sort of scheduled break within their workday. Other kind of capacity characteristics or factors that might influence one's kind of capacity side of the equation. On average, the participants were about 36 years old with 8 years of experience in community pharmacy. On average, they had about 2 servings of caffeine per day and had about 1.5 full-time equivalents of pharmacist staffing per day. And then about 3.5 technicians per day. On the other hand, when you consider demand characteristics, right, they were filling about 400 prescriptions per day, but that ranged. I had one pharmacy that said that they were doing 15 prescriptions a day, and another one that said they were doing 18. As you can imagine, the person with 15 prescriptions was doing great. She was loving life. But most of the pharmacists reported that they worked 10 out of the 14 days where they wore the bands. So what happened? So you can see here, I broke it out in a little bit different levels, but so we have kind of this high range or this high effectiveness level. Our pharmacists spend about 60% of their time here. And at this level, you know, their reaction time would be slowed by about 5%, performing at a 0.00% blood alcohol concentration with a very low risk for serious accident or error. Next up, they spent about 40% of their time in this reduced zone, right? The scores between 70 and 89. In this zone, there was about an 18 to 34% reduction in reaction time, estimating that they'd, perform at or equal to the level of someone with a 0 to 0.05% blood alcohol concentration and a low or elevated risk for accident or serious error. And finally, 4% of this time was at this very low effectiveness level with a 55 to 100% reaction time decrease, performing at the level of someone who would be legally intoxicated by the state of Pennsylvania and a high or very high risk for accident or error. But this comes with a big caveat. So the way that this data works, right, it captures all of the data for the time when a person is awake. But that doesn't necessarily mean that they're working. So you can't say that the 4% of the time that the pharmacists, were wearing the band, that they were automatically at work and that, they're at a very high risk for performing an error while they're at work. It's all the time that they're awake. But, what does this mean? Why do we care? So in a study of 27 medical residents, they found that they were in kind of this similar low range, about 27% of their time awake. So I don't know, is 4% better than 27? Is any time in this low area good? I don't know. It's kind of hard to say. There's not a whole lot done, but you can use that up to your professional judgment of at least we're not as bad as medical residents, maybe. Who knows? But I want to draw your attention to one participant in particular. So you can see this pharmacist, let me see if I can find my little, see if I can find myself, right? So they started off, they were doing great, okay. Then these 2 weeks, these 2 days actually coincided with the day that they had off. They were not working. And then we kind of go down, and we go down a little bit more, right? We're in kind of this reddish zone. Then they kind of come back up, and then they kind of peter off. And so this dotted line is actually the average for all of the participants, and this is just the one participant in question. You can see here they're kind of like scattered all over the place. They're in the 80s, maybe a little bit in the 90s. They drop down into the 70s. But for the most part, they're like pretty okay on average. But they're, you can see here that they only spend about 18% of their time at this high level and about 70-ish to 80% of time in the reduced level and then the 4% in the low. But what I want to draw your attention to, which I think is kind of the most interesting, is we can see all of these little blips, right? So in the middle, this is they're sleeping in this gray period. You can see they woke up here and they woke up here and they woke up here and here, right? And they woke up kind of here as well, right? And they have this very fragmented sleep. And so I was asking them, I was like, hey, like what was going on? Do you have like any young kids at home, or could you like explain this, or do you have any thoughts on this? And he was like, oh yeah, I just got a new puppy. And he had to wake up every night in the middle of the night to let out his puppy, right? And so it goes to show you that, yes, maybe our community pharmacists fatigued? Maybe, I don't know, right? But it kind of goes to show you that there's this very fine balance between what we think that we do at home and what we do at work, and they kind of all cross over. Because just because the pharmacist didn't get a good night's sleep here, they still had to go to work and perform for the rest of the day here. But it doesn't necessarily mean that it's their work causing their fatigue. It could be their home life. So are community pharmacists fatigued? Maybe. So that's what I'll pose to you. Of the data that I've showed you, do you have any questions, thoughts, or concerns about the data and the type of question that we're asking? Yeah.
How does the biomathematic data correlate with the surveys that you give them? Yeah, that's a great question. So we're not totally done with a lot of the analysis yet, but what we're finding is that actually the surveys, when we ask the pharmacists on their surveys, they're actually performing a lot worse. The surveys say that they are more fatigued than these bands do. And so when pharmacists look at the data, they're like, oh, like I'm actually kind of surprised. And I have a justification to answer that, but I'm wondering if anyone else has a thought before I spoil it. Thoughts? Did I see the semblance of a hand coming out in the third row? Maybe? No? Okay.
Dave's got an answer, Dave. Can you repeat the question?
Yeah, right? So, does this data convince you that pharmacists are fatigued? Put it another way.
Kind of. I mean, given like the data that you show is strictly just based off of like how you mentioned, it's when they're at work and it's when they go home, and there's a lot of different factors that can play in and carry out throughout time that would affect their scores.
Yeah.
Going off of like the surveys that you handed them, it kind of seems more that like mentally like evaluating yourself versus what like is actually being collected data-wise is more powerful.
Yeah.
Or at least maybe kind of has a bias to it.
Sure. Yeah, no, absolutely. For the folks on Zoom, I'm sorry that you didn't get to hear that great answer. But it was that, that maybe there is a difference between, your mental kind of perception of fatigue, and maybe that has more weight than sometimes what objective data shows. Absolutely.
Thanks, Dave.
Yeah, thank you. Thank you. Anyone else have any thoughts?
I have a concern.
Yeah.
So wouldn't CVS be able to basically look at these bands and determine whether the pharmacist is performing and then kind of fire them?
Yeah, absolutely. So the question was, couldn't CVS look at this band data and, see how their pharmacist was performing and fire them? Yes, right? That's a huge concern. And so when I was first beginning this research, right, I was thinking I'm going to partner with Walgreens and I'm going to have all these Walgreens pharmacists participate. And Walgreens is going to be really on board because they're all about patient safety and they don't want their pharmacists to be fatigued. One of my mentors sat me down and said, well, Taylor, it's actually a big liability concern, right? So say a pharmacist, CVS in this case gives all their pharmacists these bands, and they know that Ravi, after wearing the band for a couple days, is fatigued. And Ravi has a shift to go in and he's scheduled to work. Now, Ravi, it says his band is fatigued, and CVS doesn't do anything, right? CVS doesn't intervene, right? And so then Ravi goes to work and he makes a mistake and it seriously injures a patient. Well, who's at fault? Is it Ravi? Because Ravi went into work when he was fatigued and maybe he knew. Is it CVS's fault? Because CVS knew Ravi was fatigued and they let him come into work anyways. Is it CVS because they didn't have systems in place because Ravi didn't feel comfortable to call off, didn't have enough staff, so Ravi felt like he had to go in anyway? Sorry, I'm just throwing you under the bus. You're just, But, it's a huge question and a huge consideration when we think about this of, in theory, they could. One of the big kind of disclaimers that I had to put on doing this data collection was, wouldn't recommend sharing it with your boss unless you're comfortable, right? Because there are all of these implications. So yeah, it is a huge concern and definite implications for that going forward. But great question and great thought. Any other thoughts?
This does not convince me, but I don't think it's correct. Because you went on your soapbox and you only looked at sleepiness.
Oh my goodness, my girl. Yes, right? Sleepiness does not equal fatigue. And the thing that kind of not irks me, right? But you have a company that calls themselves Fatigue Science, and they're primarily looking at sleep data, right? The only input that they use is whether or not you sleep, how much you sleep, your wrist movement to determine whether or not you are sleeping, right? I had this whole big thing about that's how they model and that's how they calculate fatigue, right? And so it's really important when you consider using a lot of these sensors, right, is to balance it out with other kind of metrics, right? Whether it's subjective measures, whether it's having logbooks of all your pharmacists and kind of, watching them to see if their eyes droop, right? And so that it maybe it's telling me that they're fatigued, but it's also highlighting a whole lot more of other things that are going on. So when we think of fatigue and we think of fatigue risk management and kind of the process looking forward, right? We have our work demands and our capacity, and these bands do a really great job of giving us some insight into our capacity. It does tell me if whether or not Ravi may be able to work at his full capacity because he may be out taking his dog out to the bathroom at every hour of the night. I don't know, right? But it provides us some insight into our capacity to be able to do work, but it still doesn't really address this whole big pile of demands on the other side. So kind of thinking for the future of pharmacy and what does it mean? So this is Fatigue Science's model, as I talked about, kind of how they predict and assess fatigue. This is my model. Years and years of culmination of my dissertation work has a little bit more steps to it. Right, so you can see here that, right, so I have fatigue here. It is an outcome, but it kind of built off of all of these other things that a person is dealing with. Right, and so this model in particular, it takes a lot. I told you my minor is in industrial and systems engineering. The specific model and framework that I use is the Systems Engineering Initiative for Patient Safety, or SEEPS framework. Right, so it takes into consideration this person and how they're sleeping and how they are, all of these other personal characteristics like their age, the number of kids that they have at home. Are they working another job to make ends meet, right? But it's also taking in all of the other work demands in their environment, things like the tasks that they're asked to do, what tools and resources and staff do they have access to, right? As you mentioned before, part of the reason why pharmacists might be fatigued is because they have no technicians to do their work. It talks about their physical environment and the fact that pharmacists are, contractually, they're obligated to stand for 14 hours a day, right, with no bathrooms. their social and organizational models of the culture that they work in, as well as external things like COVID, right? Maybe you're working in COVID and now you have 50 other million things that you have to do, like COVID tests and COVID vaccines. And it tries to take all of these things into consideration when considering the processes and the work that pharmacists have to do and how that can lead to fatigue and outcomes. So once again, it tries to capture all of the different things on both sides, not just the capacity, but our work demands as well. So when we think about fatigue risk management, it's all about kind of balancing this kind of scale, right? And a lot of fatigue risk management platforms or programs that we see it as like a dual edge responsibility. There is the responsibility on behalf of the pharmacist to come to work well rested, to the best of their abilities, become fit and ready to perform. But there's also the work on the organization to minimize or to help provide resources to be able to complete the work demands. So even if there's 500 little like circles on the work demand, you still have 500 resources on the capacity side to balance it out. All right. So going back to kind of the pros and cons, and that's why we're all here today to talk about wearable sensors, because they're cool, right? So what are the pros and maybe some cautions that I would warn you about? So the pros, they're really cool. They tell you a lot of really, really cool data that is really fascinating, at least to me, right? And they help to visualize one aspect of capacity, sleep. They also have predictive capabilities for fatigue risk management, so saying whether or not Ravi is fit to perform or fit to come into work, and there's implications for that, right? But it comes with some cautions. It asks, you have to ask what type of data are you actually getting? What type of data are you actually getting? And what kinds of questions can you answer? So maybe it's not so much fatigue, but capacity. And maybe that's my own personal soapbox, right? That they're not the same. But so just knowing, to be cautious whenever you see something touted as a fatigue science ready band and, kind of thinking about all that it captures. So here's kind of my question for you in the last, 15 minutes, but also happy to entertain any other questions. Knowing what you know and what we've presented, what kind of questions would you ask about fatigue, sleepiness, or capacity using the ready bands? Is there a population you'd like to test this in, somewhere you think you might see an answer, or just any other questions that you have? What are your thoughts? Yeah.
I'll start because I'm coming from a graduate student perspective, and I was wondering if you found your own personal data kind of surprising, as we know that pharmacists have this perception of fatigue and overwork, but graduate programs and graduate students also have that, always strive to work through the weekends and work at odd hours. Were you surprised with your results from your ready band, and did that make you consider, maybe this isn't capturing as much of my fatigue as I thought it was going to?
Yeah, so that's a great question. So full disclosure, I have a sleep disorder. So this band was totally out the window anyways, right? But I think for me, and I think it was emphasizing for me in my culture, as you mentioned, kind of to your point, right, is what kind of culture are we promoting? I think for graduate students, yes, but also for pharmacy students, right? There's this culture that you have to work 24/7, 12 hours a week, have a job, have an internship at Rite Aid, do APPEs and an ARCO and 50 jillion other things just to be qualified to do a residency. So it spoke a lot to me about what kind of culture are we promoting, and asking questions regarding, what are we asking of our pharmacists, of our student pharmacists, of our graduate students, and what kind of impact might that have on their sleep? So was I surprised with my own data? Maybe. I don't know. It's hard to say in the context of, a sleep disorder, and that's probably what answer you'll get from me most. Maybe. I don't know. Come back to me in 48 days when I defend my dissertation, and I'll probably have a more solid answer. But yeah, that's a great question and a great hypothesis. Your thoughts?
Did you look at any type, or did you rule people out based on any type of sleep disorder? So if people were taking medications, did you rule them out?
Yeah, that's a great question. I personally did not, but I did ask questions about that. Okay. So one of the biggest, I wouldn't call it a disorder by any means, but one of the biggest things that people did mention was that they were pregnant. So I had a large sample of individuals who larger than I expected, who were pregnant and whose sleep was disrupted based on that. And so I was able to ask those questions and categorize them to be able to separate them. But they actually had some of the highest levels of effectiveness out of any of my other population. But yeah, that's a great question of things that you would like to control for or ask about. That's a great point. Thoughts? Yeah.
Just out of curiosity, how did you approach the pharmacists or like recruit the pharmacists in the study? Did you need permission from like CVS or Rite Aid or wherever you were going as well?
Yeah, that's a great question, and fantastic. So the way that I recruited was actually through kind of a third party. Pennsylvania has one as well, but there is a pharmacist-based research network. And it's basically a repository of pharmacists who said, yes, we're open and available to be contacted about research. And so we sent them emails directly. So I didn't necessarily have to get permission from employers to be able to study these individuals. And honestly, I had to put in the consent that, maybe you don't want to tell your employer that you're being studied. While they wore the band while they were at work, I never asked any kind of information about where do you work at? What store do you work at? Let me write all this down so that I can report back to your provider or to your boss, right? So didn't have to get that specific permission from them. But as far as kind of incentivizing them, we did offer them $100 to be able to participate, and we let them see kind of their Ready Band results. So a lot of pharmacists were really interested in that and thinking that it was cool. The other thing is that the pandemic kind of worked in my favor. I didn't plan it when I started the study, but community pharmacists are always happy to tell you about their problems and, are happy to kind of gripe about things, which is great for me. Again, loved it. But, kind of using it as a forum, this was all individual interviews, but providing surveys, providing data to provide them an opportunity to share their experiences. I think a lot of pharmacists appreciate it, and we're happy to do it. Plus, if I can also tell you anything else as a student, pharmacists are really happy to help you and really happy to help student projects. So just by saying I'm a student, which isn't incorrect, but I'm a student doing research, this is for, my huge dissertation project, it would really mean a lot. They were really willing to participate. Long answer to your short question, but yes. Question. Yeah?
I saw that you also took out caffeine and how much caffeine intake. Is that something that you would like to dive in further to see how that might have skewed data, especially if it's capturing something as wrist movement, which if you're, at least me, when I have a lot of caffeine, I find myself a little bit more animated in my movements to see how much external kind of trying to combat fatigue would affect.
Yeah, that's a great question. So the short answer is we checked and we found no association, right? So we ran, what I didn't really go into is I ran a number of associations trying to explain some of the differences that we found in these READY scores. So things from personal characteristics to work characteristics and, number of caffeine drinks consumed, and did not find a difference. If I had to take a guesstimate of why that's the case, so caffeine works, let me go back. We go back to this model here. So whenever I talk about sleepiness, right, it's your body's signal to sleep. The way that caffeine works is by muting that signal in your brain, right? And so that's how it works. And that's why you have after your caffeine wears off, right, you have an immediate drop. So it's possible too, based on the time of day when folks consume caffeine, it's usually in the mornings. So, right, it affects that sleep reservoir and the feelings that you have of sleepiness. It kind of mutes some of those signals in your brain. So I wasn't really expecting it to change too much, but maybe, depending on when those caffeinated drinks were. But short answer is no, and I didn't see a response, but it's not to say someone like me who drinks 6 Diet Cokes a day, that wouldn't impact me, but also probably why I have a sleep disorder. So getting really personal here. I can share with you my thoughts of areas that I would like to take this further, or some next steps that I have. So impact of shift work for hospital pharmacists, so pharmacists that work overnights, 24-hour stores on call, right? The part of the reason why I think I didn't necessarily see some of the variants and some of the reasons that you all had about why pharmacists might be fatigued are those long hours. But in general, right, the community pharmacists that I work still closed by 9 o'clock, right? So what is the impact of, on sleepiness in these work systems for those pharmacists who work more kind of irregular shifts? Impact of long work hours for pharmacy students and residents, right, who are awake for long hours at a time. fatigue across entire teams and the impact on scheduling, including pharmacy technicians, pharmacy students, etc. If I know that Ravi works really well in the morning and Keith works really well in the afternoon, well, I can schedule them, for those specific shifts and try and maximize my team. Similarly, can we predict if someone or not is fit for duty, and what are some of the organizational implications if they're not? A little bit heavier, as we were talking about with liability, but there are some options there. Impact of implementing rest breaks. So I will tell you, in nursing, they're having this new thing roll out called nap breaks, which I think is fascinating. It's you get 30 minutes of protected time scheduled in your day, and you get to go to like a dark room with massage chairs and the lights are off. And you get to take a nap for 30 minutes. I was like, gosh, and pharmacists don't even get bathrooms, let alone like a place to sit down. So I don't know how we're going to get nap breaks, but maybe rest breaks, Now with CVS and Walgreens rolling out these lunch breaks, maybe will have an impact on this band data and what it tells us about sleepiness, maybe. And also the impact of rumination. So this idea of rumination is when you're worrying about something before it happens, or you're in anticipation of the demands that you have. And that impacts your sleep. So it's kind of a cycle, right? If I'm worried about an infectious disease exam that I have tomorrow, well, in worrying about that exam, I'm not going to be able to get a good night's sleep because I'm too worried about it, so I'm going to stay up all night. So then when I stay up all night, I'm not as effective because I stayed up all night and I wasn't able to sleep. And it kind of goes in this cycle, right? Because then you're worrying about how your one ID exam is going to impact the rest of your grade forever and ever and ever. And right, and it plays a lot into your anxieties, but it's this vicious cycle about how you worry about your work and how that impacts your sleep and so on. And does that vary for different positions like management or, people who are, again, on call, or people who are facing technician shortages, et cetera, et cetera. So those are some of the places where I could see these bands used in practice, again, being very cautious of what type of data that they provide and allow. But with that, that's kind of a grand overview of one aspect of my dissertation. And I'm happy to take any more questions on kind of this topic and more in the upcoming things. Yeah, thanks, guys. Thanks all for participating.
Yeah. Questions from the audience? I'll see one.
Oh, yeah, in the back.
Go ahead.
What do you think like a timeline for like practical implications of the bands would be like? Could you see like a class of, 2026, like using these bands or something like that, or like pharmacists, like in the near future?
Yeah, that's a great question. The question for Zoom was whether or not I could see a timeline for implementation of these bands. So I will tell you that this company, Fatigue Science, they are in practice more so, or they're in use more so in a heavy industry. So the company CAT uses them on all of their kind of employees. Again, active military, I believe the Seattle Seahawks use them, like elite athletes use them to help with their training practices. They are fairly pricey. So when I first started this research, they were ranging around $200 per band, and now they're up to about $500 per band as the technology increases. And so it can be very pricey to be able to do this, or, for a small independent pharmacy that would be genuinely interested to be able to roll it out. So I think it would come with grant funding, one. But two, I think the technology is out there for people that are able to pay for it. Part of the other motivation behind my dissertation was to try and figure out a way to validate the surveys, right? To be able to say, okay, so you can't afford this $500 band, but maybe you can have this paper survey that showed similar results to this $500 band, and you can use it instead and only pay Taylor $25 instead of $500, right? But that was kind of the initial motivations. As I kind of mentioned, it's very tricky because pharmacists and students rank themselves higher as more fatigued than these bands show. So it's it's still very complex. But I could, in theory, see it happening, but there would have to be a large decrease in price or increase in concern about this issue to utilize them. Zoe, is another question? Yeah.
So when you're kind of like showing how the effectiveness score can have somewhat of like a correlation to like a BAC level, and some sort of impairment, have you been able to like collect like performance measures of a person's like task throughout the day at specific times of when they fluctuate through those levels, and see like where margins of or like errors and misclicks and other stuff that happen more commonly?
That would be a fantastic area for research, and I think that would be a fantastic next step. I have not personally, but I think that would be fantastic. There's been some work done in the use of logbooks right? So having individuals kind of note down like what time of day if they notice that they made an error or things like that. And again, that's still very subjective. I have had pharmacists anecdotally report, you'll see a lot of fluctuations around lunchtime, and so a lot of pharmacists will anecdotally report that like around the time of like 2 p.m. they do fluctuate, they'll start to dip and they'll notice that. But I don't have data on like errors or correlating that to errors or misclicks or, effectiveness and performance outcomes. But I think that would be a great opportunity to study. And we should definitely pursue that further. But yeah, it gets messy, but I'm interested to talk to you more about that. Yeah.
When you asked like what do you think causes stress in pharmacists, I didn't add this, but like I always felt that it was like the variety of responsibilities that like as an intern and especially as a pharmacist you are required to be on top of. If Schedule 1 comes in, that's you. If a phone calls in and you have to transfer it, that's you. Like you have to be wary of the person at the front of the line, the phone if it has to ring, and all the things that only a pharmacist can do. As you're talking about the changes we can make organizationally or structurally, are there specific areas where responsibilities can be kind of spread out throughout the pharmacy itself to technicians, to interns, where you think there could be a great impact?
Yeah, absolutely. So to reiterate, it was kind of this idea, and what we see summarized a lot is pharmacists do not have a lot of control over their profession, right? You have kind of a lot of inputs and a lot of kind of areas in which your work can be, kind of where you can be stretched thin. So the question was, are there ways to kind of reappropriate roles within the workforce? And I think definitely, and we're seeing that a lot with COVID. Right, so in some states, we're seeing the tech check tech. Wisconsin is called tech check delegate, delegate check delegate. But it's a way to move some of the final kind of product verification off to a technician. We're seeing that a little bit with remote dispensing sites. We're seeing that with phone call centers where, a lot of our phone calls are triaged. Doesn't work as well as some would hope. We're seeing that with technician administered vaccines in some cases, right? A lot of these technical skills and utilizing our technical and our auxiliary staff better to be able to free up pharmacist time for those clinical services, which still require a lot and may result in a lot of mental fatigue, but less so than trying to balance 500 different things at once. One of the areas too that I thought would be a big factor but wasn't was this idea of pharmacist overlap, right? But a lot of that comes from there's still not very clear designated roles even when there is overlap. So there's a lot to be done there, but yes, I think that would be a good example of systematic change that may, kind of free up this perception of, lack of control. But yeah, absolutely. Thanks.
One point along this question of policy for professions that do have limitations around restrictions. Do you know, or did you pull any of the frameworks for your studies from this work, or do you know if they exist, or was it simply policy of let's be mindful that people get tired after 60 hours?
Yeah, that's a great question. So for Zoom, it was, in other professions, what do some of those policies look like? The biggest one that I can think of is in the Academy of Medicine and Medical Education. The acronym is escaping me, but they have a specific policy that limits the number of hours that medical residents can work. And a lot of that comes out of, actually, for those of you that are interested, I don't know if you've heard of the case of Libby Zion, but it was a case of an individual who, a young girl, she was about 18 years old, was seen by a series of residents in the ER, ended up having a really bad, what we now would call serotonin syndrome, right? Had an adverse medication reaction and ended up passing away. And it wasn't until after the legal lawsuits that they found out the physicians were working for about 40 hours at the time of which the error occurred. And so has then passed the Libby Zion law, which is this idea of duty hour restrictions. Oh, thanks. Yeah, thanks. But yes, to your point, so duty hour restrictions are big in professions like nursing, and from the nursing board, medical residents that limit them. I believe the duty hour restrictions for medical students or medical residents are 60 hours a week, but it puts a cap, like a hard cap, on the number of hours that they're able to work, number of consecutive hours that they're able to work in a row, because they've seen these connections between safety and long work hours. But that could be an area. And Illinois tried to pass legislation like that for pharmacists, and it went terribly. So hard lobbies against that.
Questions or comments? If you could join me again.
Thanks all.
And being mindful that you have a flight back, we wanted to present a very heavy gift.
Oh, nice, yeah. Thank you.
Of course, thank you for being here.
Yeah, thank you.
Yeah, and for those of you joining on Zoom, we'll certainly be sharing the recording here as well. So let me go ahead and stop our recording.